we are being put into the category, even when we're totally healthy, we're being put into categories like pre-diabetic or pre-cancerous, right? And a lot of that comes from these well-meaning pushes to, to map the genome and be able to predict risk factors for different kinds of diseases. But we also need to think about what are the kind of social and cultural and human consequences of that. What are the existential consequences of becoming a population of people who understand themselves as people through the idea that in a certain amount of time they will become sick. In disability communities, there are generations worth of knowledge about how to navigate medical systems, about how to create joy and beauty in spaces of pain, about how to build community when you have scarce resources, whether those are financial resources or energetic resources, and how to create accessible spaces that are not only accessible to people with particular disabilities, but that are broadly accessible in terms of community participation, right? In terms of the economic threshold that someone needs to meet in order to get to an event, right? Or in terms of infrastructure, which is a big issue here in Houston. One of the things that's important to us is helping people who are going to go on to become doctors or to become clinicians or to become engineers who are working on prosthetics, to help them think about the human experience as part of what they're doing, right? Not to shy away from the complexity and ambivalence of the spaces that they're working in, the complexity and ambivalence of illness and health and healing, and to make sure that they bring that into the work that they do as doctors or as health professionals in any way. It's also work that we're doing for our own scholarly communities to help build bridges and links between disciplines that might not talk to each other. So, what does a historian of medicine have to say to a religious studies scholar, right? What does a medical anthropologist have to say to someone who's working on big data, right? And actually, medical humanities is one of the ways that we can create these interfaces that allow us to do interdisciplinary work. And whether we're aware of it or not, our daily experiences are shaped in a lot of ways by social and cultural ideas that we have about what constitutes health, what constitutes good care, who's deserving of what, and how communication around these things should happen. And medical humanities is one of the ways that we can think differently about those things that impact us every day. We can think differently about what good communication looks like. We can think differently about what storytelling looks like, or what it means to describe an experience of illness.